today's meeting is actually quite open. We didn't have many agenda items. There was one thing I wanted to mainly discuss with those who were here. I was looking more, and could be something you are all very familiar with. This could just be more new to me, but since as of March 2024, I believe India had launched their national action plan for snakebite envenoming, sort of strategic action plan that took a One Health approach to sort of outline uh, policies and directions for snakebite elimination across the country. And since then, there have been a few different publications about, challenges in adoption and how things are going. So that's something I wanted to briefly discuss with the team here today, and also just see, if in your contexts, if you are also aware of national action plans or any guidelines that you'd like to discuss, we can also talk about that. But I'll briefly share my screen so people can get a quick look at what I'm talking about. So this right here is the National Action Plan. It's a PDF that's available online through India's Ministry of Health and Family Welfare. And as I said, this was launched in March 2024. So it's been a year and a bit since it's been out there, and it's a pretty lengthy document. So if you have time, I would recommend kind of parsing through. But I thought there was one paper that did a pretty good job of summarizing bits and pieces of it. So there's five main objectives of this plan, which are all quite expected, I guess, of a national action plan for snakebite envenoming. It's reducing morbidity and mortality, increasing awareness, improving access to treatment, strengthening healthcare infrastructure, and enhancing surveillance. And under each of these objectives, they've outlined particular activities and actions, but also there's a really robust monitoring and evaluation plan with indicators on these things. So some of the actions they've outlined, and as I said, it takes a very One Health approach. So you'll see it's not just human focused. There is a human health component where they talk about increasing availability of ASV by making sure that public health centers across all states are stocked with ASV supply. But there's also increasing access to emergency services. They mention in the plan that transport to local hospitals often causes a lot of delays. And then training healthcare providers. I know Marcel is on this call, so this is very, very relevant to the Zambian context as well. Training healthcare providers is also outlined as a key component of eliminating or mitigating snakebite impacts. But then the action plan also mentioned wildlife health component and an animal and agriculture component, um, which partly has to do with education and awareness in terms of educating the population on where snakes live and safe practices, but also preventing snake bites in livestock, because a lot of farmers don't just experience snake bites themselves, but also their livestock experience snake bites as well. And within that, there is a strong community engagement component. And I thought a lot of this, although it is specific to the Indian context, I think in a lot of places where snakebite is endemic, things like community awareness, traditional healing practices, these are quite common across a lot of different regions. So I thought it was, more broadly applicable to regions like that as well. And then in the action plan itself, they've sort of identified people within each region, which they call nodal officers, to take charge of elimination activities. And then there's another paper here, which I didn't link in the meeting invite, but I'm just going to scroll down to find one. Yeah, there we go. So this kind of shows different experts spread across the country that they've identified and linked up with. And turns out this action plan took a couple of years to kind of put together after consultation with all of these different people. So it was quite a great effort. And I wonder if anyone involved with the Snakebite Hub was one of these people here, but that would be really cool. But yeah, it's just to say that it was, it was involved a lot of people to come up with this, and actually these partnerships across the country are also key to implementing a lot of the interventions that the action plan suggests. So it talks about things like, as I said, increasing antivenom availability across public health centers, but um, training healthcare workers and educating communities um, through community health worker programs as well. But that's kind of that's the action plan in a nutshell almost. But I wanted to maybe pause there and ask, so those of you who are on the call right now, are there sort of similar action plans in your settings that you are aware of? And if so, is it in your opinion, are they adequate? Do you think there is a need for one in your setting? I just wanted to open the floor for some discussion related to that. I see there's only a few of us on the call here today. Maybe I can pick on some people. I know in Zambia's case, Kingford and Marcel, Marcel was actually the one behind the national treatment guidelines for snake bites. So I know it exists in that setting, but I guess that's not necessarily a larger action plan for elimination, but more focused on the actual treatments. But is there in Zambia, is there national guidelines as well for elimination overall?
Yeah, good afternoon, everybody. So we have the snakebite treatment guidelines in place. They
Mm-hmm.
were launched last year, but we don't have any strategy or any implementation plan to improve snakebite management in Zambia. Since the guidelines, everything has kind of grinded to a halt. Um,
Mm-hmm.
so yeah, I'm very happy to see this document, and it looks very comprehensive, including farm animals,
Yeah.
etc., which is really good. So I'm quite impressed actually. Uh, and yeah, it's something that I would like to use maybe as a blueprint to see if we can develop something similar in Zambia, because we definitely do need it. It's just not there.
Mm-hmm. Yeah, that's what I was thinking. I was like, the document itself is actually, it's very, very detailed. If you go through some of they've got, we scroll down to some of these tables. So there's a lot of forward from different important people. Sorry, you guys are gonna get dizzy looking at me scrolling through. But there are very, very specific sort of activities lined up. That gives a historical perspective as well. So there's some epidemiological information near the beginning. Um, you have all these different snakes, clinical manifestations. Um, but yeah, they have some history about a regional action plan that was developed using the WHO's action plan. Um, the actual action plan doesn't start until a little bit later in the document. They give a lot of history and how they came to actually create this. Then they have, strategic components like this, vision and mission. They have very specific activities that they go on to list over the next few chapters. Part of the action plan is also implementing surveillance. So there's an existing surveillance mechanism um, for disease reporting, which they'd like to integrate this into, but they've been very specific about components of the surveillance system, um, recommended case definition, and then, as I said, they have a very robust monitoring and evaluation framework as well, which I can scroll down and briefly show you. This is on ASV. It's very long document. Yeah, so they have a pretty robust, and they have all these indicators for monitoring and evaluation, all at a national level, but also at state levels as well. So I'd say it's quite well thought out, it seems. But as I said, it took about 2 years, I think, to work with experts across the country and come up with this thing. So it was quite an undertaking, but given that it's out there and it's freely available, um, it could definitely be leveraged and adapted to other settings. So just want to make people aware if they aren't already. Um, see if anyone else on the call, if you have any comments about this plan or plans in your setting, maybe I can pick on some of the others who are in this call. Eric, are you aware of something similar in Ghana?
Hello, hello,
Hello, hello, hello.
hello. Yeah, greetings to everyone. Yeah, so yeah, this guidelines is very important. Yeah, to meet the
Mm-hmm.
WHO's 2030 agenda. To meet WHO's 2030 agenda, but
Mm-hmm.
unfortunately, yeah, and to the best of my knowledge, there's no such guidelines in Ghana yet.
Mm-hmm.
So we hope and looking forward that we also have such a guideline, yeah, regarding snake bite in Ghana. And you see, we have submitted a paper where uh, where we intend to assess healthcare workers, their prioritization of the WHO 2030, their key
Mm-hmm.
agenda or their key activities in controlling and preventing snake bites. Yeah,
Mm-hmm.
so we hope to share the final results with colleagues. Yeah, yes, yeah. So as I said, these guidelines. So this guideline from India is very excellent and a very good. Initiative. And I am wondering. So when we shared the document, I was thinking that how so we cannot. Indeed implement all these policies at the same times at the same time or this guideline. So is there a way to quantify the activities? I think it's about five, right? If I remember, I think it's about five of these policies.
Mm-hmm.
And yeah, if possible for us to sort the view of policyholders or stakeholders, their view as which of these five objectives to be prioritized in so that it will help us meet the WHO 2030. Strategic objectives. Thank you.
Mm-hmm.
Yeah. Yes.
Yeah, thank you. Yeah, that's a really good point actually. I know exactly what paper you were mentioning, and it is something to consider, I guess, because these big action plans and guidelines only go so far often as recommending and suggesting different things, but regional priorities might differ. And India is definitely a massive, massive country. So I guess they tried to keep that in mind with all the stakeholder consultation that they did across the country. So hopefully it has represented priorities well, but it's always worth assessing that and seeing but they do in their monitoring and evaluation framework, they do have um, indicators on assessing not just the impact of the activities, but how many were done. And they've been quite specific as well about things like um, anti-venom manufacturers and their annual capacity and what else? There we go, approved budget as well. So they've talked about budget amounts for activities under different um, different sections. So, but I don't know to what extent these are kind of upheld, or if this is just a here's the budget and we'll see if people take this up, or if this is something that they're actually implementing it year over year. So I'm curious to see, over the next couple of years, I guess, to see if there's any more publications on activities done. There's this one that I was looking at. This paper is called Implementing Interventions under this National Action Plan. So it talks about some the framework and implementing activities under it thus far, but I think the ultimate evaluation will be done in 2030 to see what worked and what didn't work. But yeah, did you make a good point? Does anyone else have anything to add? I know we have some new folks on the call today. If Mariah, Dr. Rita, Julia, hello, or if Kingford, if anybody else has anything to add to the discussion. This can be from your own
Hello.
experience. Oh, hello. Yes,
Hello.
Eric. Yes, go ahead.
Yes. So yeah. So sorry. So I mean, I noticed one thing. So the policy from India. So I see one a unique thing that has to do with the One Health approach.
Yes.
Yeah, and I think it is key because this wasn't covered in the WHO. I mean, yeah, objectives and the key activities. Yeah. So it is very key and important, and also the current, discussion on One Health. Yes, so One Health. So I'm looking forward that this India, this their plan, the action plan, how it will be integrated in the health system. I mean, I don't know whether it has been integrated in their health system or not. Maybe colleagues will help me. Yeah.
I think some bits of it, because it was posted in March of last year. I know that some of the surveillance activities have been implemented. I'm not totally sure about other ones, but there are some bits and pieces that have been implemented thus far. But you make a good point about One Health.
Yeah. Well, so I don't have, let me say, this issue of snakebite and the implementation. You see, what I've gotten to know so far is that it's also politically motivated. So if governments, so I think these policies, they are good policies to help countries to meet these WHO 2030 objectives, but also there's also be the political will, and once, let me say, the health, let me say the Ministry of Health really embrace these actions, then I hope that it will be very effective. It will be effective, and healthcare workers or like policymakers will really implement this in the health settings so that it will contribute to achieving the WHO's 2030 objectives. Yeah, thank you. Yes.
Thank you for that comment. Yes, no, political will can be a make or break, I think, everywhere. And it becomes particularly important with medicines and distributing antivenoms and things. So yeah, definitely. I think it's quite good that in India's case, it was the Ministry of Health and Family Welfare, which to my knowledge, that ministry has been quite good at sort of national program planning and evaluation. So it was a lucky situation, but I know definitely, it's not the case in every other place. Sometimes it's a struggle to get policymakers on board, but it is so important for this for sure. And yeah, snakebite is definitely one health issue. I know that's something that we, as the Snakebite Hub, we want to do a little bit better at, because I think most of our representation is from more of the human research and clinical angle. We do have a couple of representatives who are herpetologists and snake conservation people who know a bit more on the animal and sort of environment aspect, but we're definitely dominated by the human health aspect, which is something we can work to improve in the future as well. But yeah, thank you. Did anyone else have anything to add? Oh, Eric, you unmuted. Go ahead.
Please, I mean, your colleagues who also, come in, please. Yeah.
Yes, others, feel free to jump in. It's a very casual conversation today. We don't have much else on the agenda.
Hello. Yes.
Hello.
So I mean, I think now it's an open talk, right? Open conversation.
Yes.
Right?
Yes.
Okay. So so thank you very much. You see, the issue of snake bite is for me is complicated, and you see, it is disease of the poor. So there's issue of funding. I believe that. So from my side, or Ghana and other African countries, you see that much work has not been done in this area of snake bite, and even from West Africa, I think Nigeria is doing better, because I know some colleagues who have really worked in this area for long, but other West African countries are not doing much in terms of snakebite research. And I think there's also an issue of funding. So is it possible? Is it possible to share some funding opportunities where colleagues can explore? I mean, with respect to snakebite, is it possible? Or funding agencies that support snakebite research, so that people be motivated to do more of this research. Even I think just last, I think I mean about 3 days ago, I mean one colleague contacted me that he would like to do some lab work. I mean, this antivenom, snake venom. They want to do some clinical trial or lab work, but I think they didn't have much funds to carry out that work. So he contacted me whether I know other people who will be able to support this clinical research. Yeah, but unfortunately, I couldn't give them any positive answer or feedback. Yes. So, in conclusion, is there any funding opportunities or funders who are willing to assist snakebite research and are not known to that are not known to the public or other researchers? Thank you. Please, I hope my question is clear.
Yes. No, thank you for your question. It's a very pertinent one, and something that I think is on everyone's minds. As far as I know about funding opportunities, I know there's big funders like the Wellcome Foundation. For example, NIH I think it's become a little bit more complicated with the US administration, but Wellcome does fund snakebite research, not specifically though. They're quite broad in what they fund. I think, as far as I know, the only specific research funding for snake bites, at least recently, has been through the African Snakebite Alliance. There might be, I think, I'm just going to Google it now. I don't know if there's any new calls, but they had an open grant call twice in the past year. So a few of our Snakebite Hub members I know have received that in the past. Here, let me share my screen for those who might not know about it. So this is the African Snakebite Alliance. So the call 1 over here. So we had some folks win, and these are they typically advertise two different grants. So there's one for £50,000, which I think is a postdoctoral one, and then there's a £100,000 grant, which is for a bigger project. Actually, Dr. Rita, who's on the call right now, is one of the recipients of the first round of funding. And Dr. Cirilli, who you might have seen, presented a previous meeting. So this is, as far as I know, like a Snakebite specific fund. They've also, I think next week they'll be announcing the next round of winners, but hopefully if this continues biannually, there should be in another few months, there will be another call specifically for Snakebite research. But I don't know if others are aware of other funding opportunities. If you are, feel free to unmute or put a link in the meeting chat if you're aware of anything else. But it is, yeah, this is a good forum to discuss. And actually, a lot of at least the African Snakebite Alliance ones, there's
Hello.
collaborative opportunities. Oh yes, Dr. Rita, go ahead.
Apologies, I'm traveling, so my internet it keeps shifting on the road. So I haven't been able to contribute much, but I've tried to. Yes. So concerning funding, yes, the ASA grant, and I think a second call is out. I'm hoping for anyone who wants to apply and wants to have a discussion to help. My first Snakebite grant was from Royal Society, funded by Welcome. So that is there. I think also we should look at the call may not be specific or say Snakebite, and we need to be creative to
I think you may have cut out there.
only Snakebite. And so if there's a
Hey.
Yes.
Okay. So I think for me, India's way is the way to go. So in the case of our Zambian situation, we do have, of course, the NTD master plan, where Snakebite, of course, has been mentioned, and in that document, it just talks about trying to conduct some surveys so that we can know the true burden of the disease, because currently we do not have that. So even coming up with a policy document, I think would be a step in the right direction, because it would give direction from Ministry of Health point of view on how we must proceed as a country. So we also have some guidelines basically in the treatment, but when it comes to other aspects like what previous speakers have said regarding funding and all that, that becomes a challenge. So I think it's incumbent upon each and every one of us, which I can call Snakebite champions, I think, to be in the forefront and probably engage our ministries of health so that we develop these documents that will guide specifically Snakebite, just like the way it is with other policy documents. For example, in Zambia, there are so many strategic plans of Malaysia, so many policy documents, but at the moment we don't have anything on Snakebites. And I think Marcel did indicate that probably we can look at the document and see whether I can adopt it in the Zambian context, and then we see how we proceed. Thanks, Ashna.
Thanks so much. Yeah, I think that resonates definitely, and I think it touches on the idea of funding as well, and that's maybe the advantage of a group like this, is that I believe Dr. Rita was talking about, not just focusing on Snakebite specific grants, but we can get creative and look at general research grant calls through Welcome. And because we are a group of international researchers here, collaborative projects are quite strong for grants as well. So if people are interested in, for example, adapting national guidelines or strategic action plans and using that as a grant application, that could be valid. Or if there's other research ideas you have that you'd like to apply for funding, you can really leverage this group and share those ideas. And if others agree with them, you can apply for sort of collaborative grants as well, because multi-country projects kind of they're automatically are more strong than doing something that's smaller scale. So this group can definitely be leveraged for that as well. Oh, I see Dr. Ponia joined. Welcome. I'll pause there to see if anyone else has any comments on funding or the action plan as well. You are welcome. Dr. Ponia, did you have a question? Oh no, all good. Yeah, if anyone else has it, if you're aware of any funding opportunities, please do share as they become available, and then that's something that we can look at as a group even. Oh, Marcel, if you wanted to say something, feel free, jump in.
Yeah, so we were talking earlier on about funding opportunities to create documents such as the people in India have been able to make. I mean, that would for Zambia also be very beneficial, but again, I always notice, but it has been like the old story, and I'm always repeating myself in these fora. All the funding that is allocated for Snakebite is all aimed at research, and it makes it very difficult that it's always research. It's nice to do research and to come up with new data and new information and new ideas, but it doesn't help the current situation, and it always saddens me to see again a call for grant proposals, and it again has this component of research, which is, to be honest, yes, we can use it in Zambia, but it's not our top priority. Our top priority is to make sure that we get people trained and facilities upgraded and so on, and there's just no money for that. So if anybody ever comes across funding opportunities for such actions, that would be great.
Yeah, policy funding is always lacking. I think I know through Oxford we have that policy fund, but I mean, it's a small pot, and it's very neglected, I think, in terms of funding opportunities for sure. I wonder actually if Welcome does something policy related.
I've asked. I've had a meeting with people from Welcome Trust some years ago, and they said no, we only want to do very big things. Like then you talk about huge projects, and it's mainly research. I don't know if that has changed by now, but it was very demotivating at the time.
Oh man, that is very discouraging. Well,
kind of, yeah. But
yeah.
I also understood. I mean, if you have a lot of money to give, you don't want to be micromanaging loads of small interventions everywhere in the world. You'd rather have a couple of very robust projects. But yeah.
Yeah, fair enough. They want the sort of hard-hitting, impactful things.
Yeah.
Yeah. Oh, Dr. Ponia, did you want to add anything to the discussion?
I think somebody just doesn't realize that they're not muted.
Yeah, I might mute him.
Thank you.
There we go. There we go. It all comes down to funding. But I guess with funding, it's one of those things where if you apply for something small and achieve something small, it gives you more leverage to do bigger things. So if there's ever something, even a small grant available, we could pursue that as a group and see. And as I said before, if anyone has any ideas, research or policy or anything of the above snakebite related, this is a really good forum to share those ideas and gain collaborators that way. I think Kingford put it correctly. We are all champions of snakebite here, so feel free to always bring your ideas to this meeting. Yeah, with that, I see our AI note takers are dropping off the call. Is there anything else people wanted to discuss? Any updates people wanted to present? Feel free to use the time now. Otherwise, we can close the meeting a bit early.
Good day, everyone.
Good day.
Yeah, apologies for joining late. I went for an official assignment. So my apologies, please.
No worries.
I like the discussion, the line of discussion that we've taken this evening, this day, and of course, this is very, very important in the area of grant. But as I always said, I'm also a proponent of let's see how we can do a collaborative research with the data sets that we have, because once we're able to do something, it's more or less like serve as a foundation that we can develop, and of course we can develop, build on it, and even apply for research grant together. So I think let's see how, since the researchers are from different parts of the world, especially the developing countries, let's see how, let's say Nigeria, Zambia, other countries can be able to sit down and work out through their data. Let's answer this question from our data, especially now that we have a template for collection of data that we've started using. I think let's leverage on that and see how we can do something again which can serve as a basis for application next time. Thank you.
Thank you, Dr. Armani. I see Eric has very enthusiastically put excellent in the chat. I think that's a great idea, and I know quite a few institutions that have been piloting this case report form are indeed interested in combining data sets. So that is, I wanted to raise research collaboration. Yes, definitely. If anyone wants to kind of collaborate on this, feel free to message and reach out, and we can make sure that people are connected, and those who are interested in pursuing common research questions can do that. Yeah, or joint publications for sure. There's a lot of expertise in this room right now, so research collaborations are a great way not just to gain visibility, but also to eventually apply for grants and make for stronger grant applications. But yeah, those who have been piloting this case report form, you will get an email from me this evening about meeting and discussing combining data. Okay, awesome. Were there any other points people wanted to raise? Going once, going twice? Okay, sold. We can stop the meeting 15 minutes early then today. As usual, the recording will be posted online and shared on our Snakebite hub. In the meantime, if you have any questions, queries, comments, feel free to email me anytime. We can get them answered. But thank you all for joining today, and I hope you have a lovely rest of your day. Thanks all.
Thank you. Bye-bye.
Thanks. Bye-bye.
Thank you.
Take care.